Hello, everyone. Thank you so much for having me here today at the International Gastric Cancer Congress. I am truly honored. I hope this is the start of a beautiful relationship. My name is Aki Smith. I'm a caregiver, patient advocate, and founder and executive director of Hope for Stomach Cancer, a not-for-profit headquartered in sunny Los Angeles, California, the stomach cancer capital of the United States. Before we begin, I'd like to outline the next 15 minutes in 3 parts. First, my story and the organic creation of Hope for Stomach Cancer. In this section, I will share how my father, who was initially staged incurable, is clinically cured and how improvements need to be made for survivors. I will also share my story as the first-generation Polish-Japanese American, also at high risk for developing stomach cancer, and some of the challenges I face since screening is not part of the American protocol. There are so many unmet needs and challenges: prevention, treatment, options, survivorship. Hope for Stomach Cancer pushes and advocates for on a daily basis. We are so much more than a patient advocacy organization. We are the very heart and center of this community. Second, what we do for the gastric cancer community and how we raise awareness. In this section, I will share some of our collaborations. I will need hours to share them all, so I'll just highlight some of our programs. And I'll also share some things in the pipeline and how we raise awareness, including Capitol Hill advocacy and research dollars and legislative guidelines for screening in high-risk individuals. Lastly, in this section, how can you be involved to bridge the gap between research and patient care? I will share areas of how the medical professionals can be involved in our mission and our vision, from the distribution of our Hope in the Bag to supporting some of our webinars and support groups. Additionally, this year, I have been very vocal about how we plan to be included in peer-to-peer published literature, and also to create a research lab for pediatric patients under 18 years old in honor of Jewel, because our data reveals that 400 children are being diagnosed with stomach cancer annually, and most of them have no genetic predisposition. So this story begins in November 2013 when my father was hospitalized with gastric bleeding. He spent the weekend at our local community hospital and was discharged with diverticulitis. It wasn't until a few weeks later my dad would hear the word stomach cancer. Once we got the biopsy results of his endoscopy, as an only child, I quickly began the role of caregiver. The first few months of his diagnosis were terrible. His prognosis was terrible. In full transparency, we went from he's going to die within 6 months to maybe this is early staging to no, this is seriously quite advanced depending on the specialist we saw. It was a very frustrating experience where there was a lack of multidisciplinary approach to diagnosing and treating my dad. I spent a lot of time researching and crying. I searched for hope. I found Google to be brutal and virtually no resources and information. Everything seems so outdated. I promised myself, if he survives this, I would absolutely pay it forward and be the voice of hope. In 2013, I switched my dad's care and we were offered a sliver of hope. He was restaged, and his treatment began with total gastrectomy, where he was restaged from stage 4 to stage 3B. His tumor was 7.5 centimeters, T4. It broke all 4 layers of his stomach. He had a benign node on his liver and unfortunately had some lymph node involvement. He was also HER2 positive, which might have been our saving grace. He did 6 cycles of FOLFOX, 25 cycles of radiation, and 1 year of targeted therapy. As his caregiver, watching him go through this difficult treatment was especially hard since there was no guarantee this would work. And another difficult aspect was health insurance. In the US, health insurance and what's best for the patient doesn't always match. For example, they approved the port for my dad, but not a power port. This minor detail delayed my dad's treatment by a week and caused so much unnecessary stress. The role of caregiver is forever changing. My role was to help him navigate through it all, from diagnosis, treatment options, to survivorship. I hold my dad's hand every step of the way. Even still, life without a stomach is hard, and the reoccurrence scares have been many. It's always my role to remind my dad and everybody here that surviving stomach cancer isn't the only goal. Survivorship entails so much more. So I want to take a moment to talk about me. I'm half Japanese, first-generation American, come from a family history where stomach cancer runs on my father's side of the family. In 2016, I started to feel hunger pains at night, and I asked my PCP for an H. pylori test. And sure enough, I tested positive. I did the strongest antibiotic cocktail, and thankfully I retested negative. In early 2020, right before the world shut down, I started to have that hunger pain at night. I was supposed to have an endoscopy, but the rest of the world, like the rest of the world, I needed to wait. By late 2020, I started to have the food getting stuck in my throat sensation. My PCP ordered a few more tests, such as an H. pylori test, thyroid testing, an ultrasound, all negative. I went to an ENT who said I had a postnatal drip and possibly silent reflux. By July 2021, I was finally able to get that endoscopy. They found chronic gastritis in my stomach and esophagus. The plan is surveillance and hoping that the issues will eventually clear with proper nutrition. But man, did that H. pylori cause some damage. I share my story today with you because here in the USA, we have no prevention screening for those high risk. I had to advocate for myself every step of the way. Getting an H. pylori test was difficult, and getting an endoscopy was very difficult. I am incredibly grateful that I built the skill set to navigate the system for my father. He is clinically cured today, but survivorship is another story. I'm excited about the progress we're making in this community: ctDNA, better diagnosis, less toxicity and treatment. This gives us hope that new technology will lead to better outcomes. I am also grateful that I've been able to advocate for myself and possibly create a path for others. But this nonprofit is not about how an old man survived a deadly prognosis. This nonprofit is about every single person diagnosed with stomach cancer, and even those that will be diagnosed with stomach cancer. The average age of stomach cancer is 60 years old, but 4 out of 10 is much, much, much younger. These are the faces of those that were told they were young and healthy. In 2016, I founded Hope for Stomach Cancer to provide resources and education to the stomach cancer community, navigational tools we never had, but wished we had during my dad's journey, and to raise awareness. Hope for Stomach Cancer is more than the patient advocacy organization. That's because almost everyone involved with the organization has been personally impacted by the disease. We are caregivers, survivors, patients, and loved ones. So, what do we do for patients and caregivers, and how do we raise awareness? So I'm going to go very quickly on these slides because of time, but I wanted to say that we are a collaboration. We don't reinvent the wheel. We work with other for-profits and nonprofits to provide the best possible programs available and resources for our patient community. We, in 2021, we redid the website. So it's called the Navigational Digital Platform, where you can go on the website and actually just kind of self-navigate through your own care. We have educational resources and webinars where patients and caregivers could look through some of the topics that we've covered in the past. We also have Hope in the Bag, which is now available in English and Spanish. People could order this online and it will get shipped right to their door. We also do Hope webinars. We do these once a month. They're free monthly webinars with downloadable slides and then on-demand viewing. The registration really gives us a place where we can provide information and receive data from what patients and caregivers are asking for. And this makes this nonprofit pretty relevant in terms of what they're looking for. We also partnered with the Esophageal Cancer Foundation with BART, and we get about 50 registrations a month. This is a Zoom style support group with 2 oncologists that volunteer their time. And again, we have a place where they can ask their questions prior to the support group meeting, which is not recorded. And this also gives us a very, very valuable data tool set where we know what patients really need and what some of the unmet needs are. We also have other types of support groups. We have our own stomach cancer support group. We have the Stomach Cancer Sisters, which are just exclusive to women with stomach cancer. And through that, we support virtual programs such as wellness and yoga. On the other things that you could get on the website, we have emotional support mentorship, NCCN patient guidelines, precision molecular profile, with which we partnered with Tempest, nutrition, and data sharing, which we partnered with Count Me In and pattern.org. So what you do is just go on stocan.org, and it really is just a fabulous, fantastic self-navigational platform where you can connect and really just get the resource that you're looking for. What we have in the pipeline, and this is pretty exciting, is the Nutrition Guide for Stomach Cancer, which is an evidence-based educational booklet regarding nutrition for people with stomach cancer from diagnosis to survivorship. We will cover topics from weight management, managing side effects, using nutrition, surgery recovery, and so much more. And the exciting thing is this is coming out free in summer 2022, and this is not going to be just your typical total gastrectomy booklet. This is going to be for every single stomach cancer patient, whether you're stage 1 to stage 4. Now, this is another thing that we have in the pipeline, and I'm going to dedicate a little bit of time here. We are working on an expert map of specialists. We have partnered with Komodo Health. Their mission is to reduce the burden of disease by linking healthcare data insights into their healthcare map, with the primary goal to capture a single version of truth of the patient journey. So we partnered with them to identify leading surgeons and oncologists who manage stomach cancer patients. Some of the key findings that we found when developing the specialist map, we found the majority of stomach cancer patients are diagnosed by medical oncologists and underwent gastric surgery by surgeons with a surgery general or surgery oncology board specialty. We've also found that in the United States, the number of stomach cancer surgeries performed, number of stomach cancer patients seen, and number of referrals, it was determined that less than 40 surgeons in the United States meet those criteria. So some of the challenges that we faced was due to the inconsistent medical coding and utilization of procedure diagnosis codes by healthcare practitioners and organizations. It is much more difficult to truly identify specialists and patient counts within the stomach cancer therapy area. This opens an opportunity to include other criteria when developing the specialist map. So that should be coming soon in April, and this will give patients and caregivers an idea of who these specialists are based by the state. So advocacy, we are part of advocacy. We do have, we are a member of the Deadliest Cancers Coalition and the One Voice Against Cancer, as well as we nominate patients to be part of the DoD PRCRP program. We also work with Congresswoman Judy Cho to come up with legislative pieces for high-risk individuals. And a big part of it is raising awareness, kind of sharing stories, creating community events, being at conferences, really kind of getting the heart out there and sharing our stories. Social media has been a great place for us, especially these last 2 years. We've been sharing other people's stories, and it's just really has been a great place to build community and help patients along with this very tragic, traumatizing journey. So how can you be involved? Here is our medical advisory board. We have our co-chairs, Dr. Wu and Dr. Klepner. They're fantastic. And this is areas where you can be involved. You can distribute this Hope in the Bag in your clinical practice. These bags are free. We ship them 6 at a time, and they're printed in English and Spanish. We also, you can present a webinar. We do these monthly. What we like is a webinar, translate your research into layman's terms to patients and caregivers. Be part of our support groups. So we do have one where we have oncologists talk to different patients and caregivers, but we also would like to start support groups where we have surgeons and other medical professionals kind of answering questions to patients. Of course, none of their support groups are recorded. So this is a really great avenue for patients and caregivers to really see the type of different medical professionals. Involve us in your peer-to-peer research. Here we are with Stand Up to Cancer, the gastric cancer research team. This has been a very great collaboration to be part of this. Here we are. You can see we are the heart of these great leaders yeah, as you can see, involve us in your peer-to-peer research. this is kind of what I've discovered. Here I am, I have chronic gastritis. I mean, I'm steps away from having stomach cancer, which is a little bit scary. So we are here to be part of your research. Anything, and just email me. And lastly, and this is probably something really important to me, so I'm going to spend another minute here. This is our moonshot: help, hope, develop, implement, and grow a pediatric lab. So in March 2020, I received my first inquiry from a mom, her name is June, that her 16-year-old daughter, Jewel, wasn't given much hope. This was the first time I heard of a stomach cancer in a child, and it was truly heartbreaking. Through their story, we were able to see their trial and tribulations, which exposed a lot of unsettling truths. For example, the very limited options Jewel had on account of just her age alone. I remember praying that Jewel make it to her 18th birthday. Unfortunately, Jewel passed away in December 2020, just 3 months before her 18th birthday. Since that time, more families have come forward, and Komodo validated the data. There are 400 annual diagnoses a year in the USA. Here at Hope, we'd like to offer two things: a support structure for all those new diagnoses, and a lab to profile these tumor tissues. We strongly believe we might find a new genetic component to the increase of stomach cancer in our youth. So I'm running out of time here, so I probably can't share this slide too much, but please email me and we really can discuss some of our findings in terms of these pediatric cases. And I'd really like to conclude here. Thank you so much for being here and listening to what Hope for Stomach Cancer is and what we do for our community. We are the heart and center of the research and the reason why we're here today. Speaking on behalf of all those who have been affected by stomach cancer, whether you're a patient, caregiver, or loved one, we all wish that such an organization as Hope for Stomach Cancer didn't have to exist. We all wish this was a manageable disease like diabetes, or even a curable one like testicular cancer, but it's not. It's a worldwide silent killer, and our standard of care is debatable and our options are limited. The only recognized cure at the moment is surgery, but for many, that's not even an option at diagnosis. I want to close by quickly summarizing who we are, what we do, and how you can be involved. We are patients, caregivers, and loved ones. We truly believe that by bridging the gap in patient care and research, we will find a cure. While it has been a blessing and a curse, my personal experience, my cultural background, and my empathy makes me a great leader. We provide a lot of educational support and resources to the stomach cancer community. We have some exciting programs that will be added to the pipeline, such as the expert map and the stomach cancer nutrition booklet. We have a lot of areas where you can be involved, from distributing bags to your patients to presenting a webinar or answering questions in the support group. You can involve us in research. After all, we are the heart. But most importantly, let's rise up together and help us build this pediatric lab. With over 400 patients under 18 years old being diagnosed with this deadly cancer in the USA, we need to investigate the cause and create a path for those children and/or include them in clinical trials. Thank you.